We welcome to the program Mary Beth O'Connor, retired judge and author. Mary Beth, thanks for joining us on Middays.
Well, thanks for having me.
So what brings you to Mississippi? I read a little bit about your bio and coming to this conference. Share with our audience a bit about your story.
So I grew up in a really abusive household, which is a common entry point to having drugs look like an attractive option. I started using alcohol at 12, and by 17, I was shooting meth on a regular basis. I didn't get sober until I was 32, so it was a really long haul. But I did finally get sober. At 6 years sober, I went to Berkeley Law School, and at 20 years, I was appointed a federal judge, and I always emphasize early retirement. And now I do a lot of speaking. I do workshops and trainings, and I talk about my story, hopefully as a stigma reducer, as a sign of hope for someone who's had physical child abuse, sexual child abuse, multiple rapes, violent boyfriend, and 15 years using meth, and yet able to find a happy, productive new life. And here is an opportunity to talk about that as well as the multiple pathways. So not everyone gets sober the same way. There's different approaches, and that's sort of part of my focus.
Well, the first reaction is congratulations for surviving all that and overcoming all that, and then excelling and being a very productive member of society, because often folks that are dealing with substance use disorder, they're not really producing to their full potential for society. But more importantly, was there a time, Mary Beth, when you felt like this is it? It's over? I'm not going to survive it?
There was a long time where I really believed that using substances was my best choice. I mean, I really thought my pain was so deep and so vast that I could either commit suicide or have a mental breakdown and get committed to a facility, or I could keep using. It was really, those were the choices that I thought existed. I was wrong, but that's part of what kept me trapped for such a long time.
Wow. Unbelievable, those kinds of obstacles to overcome. So what's the message here today? The End It for Good organization, of course, is an advocate for approaching this issue in a more innovative manner than just locking people up and throwing the key away and letting them serve their time, and then we release them back into society and they still have the same problem.
Yeah, they have the same problem. They have a lot of consequences in their life from a criminal record, right? You can't get housing, you can't get a job, you can't get some benefits, and so that's all problematic. Part of what I talk about in hopefully an effort to increase understanding is that a very high percentage of people that develop a substance use disorder, it's a pain management strategy. And so it's often due to trauma history or mental health that could be because of life experiences, or it could just be biological, that you were born with that mental health condition. And one of the challenges, and I will have 30 years sober in January, and a lot's changed, and now we really focus on addressing both the substance use disorder and other mental health conditions from the beginning. Because if they're both tackled from the start, the odds of success in getting both under control are going to be a lot higher.
Yeah. You know, as a business person, always focused on economic issues, I just wonder, what in the world is this costing society, just dealing with this issue, or members of society that aren't able to perform up to their potential? To some extent, we're all paying for that.
Well, I'll say this, that criminalizing, putting someone in jail or prison costs 3 to 4 times as much as treatment. So you could treat 3 or 4 people for the same amount as incarcerating one. And that, to me, is an important data point that I'm not sure people fully appreciate. But yeah, there's the financial cost in society, there's the family disruption, there's the pain of the friends and families who are watching their loved ones, have such a horrible experience.
Yeah.
But the person struggling with the substances is not having fun either. I mean, it's a miserable existence. It's chaos and obsession and pain and loss. And so anything we can do to help people get back on track is going to be better for them, better for the families, and better for society as a whole.
Yeah, and then the cost to their loved ones and their families. Like Representative Bain said in the last segment, virtually everybody's probably had to deal with this in some form or fashion. And I know that a lot of business folks, like myself, as a business owner, as an entrepreneur, if you've got somebody on staff, or more importantly, if somebody on your staff has an issue in their family, it affects their performance. I mean, it's just hard to deal with that and work with a clear mind.
I mean, it's true. And I will say in my 30 years, the way that the approach that is recommended for friends and family is changed. We used to talk about this bottom out idea that you really can't help people until they have some horrible, horrible bottom, but that's actually not a good approach. People die waiting for a bottom that's bad enough, but also tough love, cutting people off from their relationship with their family has a negative impact. And there's a new approach. It's evidence-based. It's called CRAFT, Community Reinforcement and Family Training.
Okay.
And there's a really good book for friends and family that I always recommend. It's called Beyond Addiction. And it can really help friends and family understand what's happening and why. Also, what positive role they can play. It's more a positive reinforcement approach. But it also does let them know what their limits are as a family member. But if someone can maintain that positive, loving relationship with their family, their odds of success are going to be higher.
Mary Beth, what do we need to do from a public policy perspective? And most of this, of course, is handled at the state level. What do we need to do? And are states starting to get on board with reforming in that area?
I mean, we definitely need treatment on demand, which most places do not have today. Sometimes I think Americans don't fully appreciate that. There isn't affordable, accessible treatment for everyone. It just isn't there. And if we had that available, catch people when they're ready to go in. We don't put them on a wait list for 3 months or longer where they drop off or drift away. That would be a real positive step forward. And then there is the new idea of harm reduction, where we want to meet people where they are and give them supports. But harm reduction, it's about the short term. Let's keep them alive until they're ready. But it's also about relationship building. People with substance problems who engage with harm reduction advocates and programs, they actually have a much higher odds of going into treatment because they feel connected and cared for, and they trust the recommendation for resources. So those are some ideas. In
your travels and in being involved in events like this, are you seeing attitudes change across the country?
I think things have definitely gotten better than they used to be. We still have a ways to go. I mean, there is substance use disorder is still the most stigmatized medical condition in the country. And people, on one hand, we seem to say, well, it is a disease or a brain disorder. And on the other hand, we blame people for having developed it, and that's a contradiction. And so, but I do think people are getting better at understanding that it's a medical condition and that we need to view it as such and that we need to attack it as such. And that's really where we need to go in the long run, is to always be thinking about what's the best evidence, what's the science telling us as to how best to help the people that are struggling.
Dr. Randy Easterling, who was also a speaker here at the event, was on earlier and just talking about how so many of our young people, they see this, they learn this from the adults in their home life, in their environment when they're growing up, and they just tend to think that's the way you're supposed to conduct yourself as an adult. I mean, this is a problem in our country, and it just seems like there's a lot of people in our nation that are almost denouncing the nuclear family.
Well, I mean, I will say, first of all, the number one abused substance in America is alcohol. And sometimes we really underappreciate that. Despite the overdose epidemic that has been in the media a lot, more people died from alcohol in the same, in 2022 than died of opiates. Okay. And, but you're right, if there's unhealthy use of substances in the family, often what the ripple of that isn't just the example, it's that there isn't a good approach as to how to handle emotions, as to how to handle conflict, as to how to resolve problems. I know in my house, because of the abuse, there was no direct connection between my behavior and what happened to me. And that's not, that has consequences in the rest of your life. It took me a long time in sobriety to realize that actually my actions are the number one contributor to my future, to my outcome. I wasn't taught that as a kid. There wasn't that connection, and it's important to have that.
Interesting. That makes sense. And of course, a child needs that in their home life. They need that away from their home life when they're in school as well. I mean, all the adults with whom they interact, that needs to constantly, I guess, be kind of pounded into their brains, honestly. That's true.
And sometimes people ask me, what's the number one thing we could do to reduce the substance use disorder rate in America, which, by the way, is one of the highest in the world. And my answer to that is always mental health treatment for children. If we can get kids the help they need early, they're much less likely to develop a substance use problem later on.
Understand. Mary Beth O'Connor's been our guest. We appreciate you coming on, Mary Beth, and appreciate you being here in Mississippi and addressing the End It for Good conference. Thanks a lot.
Thanks for having me.